As we speak, research groups are meeting with the leading research funders to start work immediately on the most pressing questions. Some of these issues include easy-to-apply diagnostics, the best approach for infection prevention, potential therapies that could be used to treat patients, existing vaccine candidates and how to accelerate them, and how to address the infodemic. We're also doing deeper investigations to identify the source of this virus and to prevent further transmission from animals to humans.
I think we have to be very cautious. The stabilisation in cases in the last number of days is very reassuring, as the DG has said. And it is, to a great extent, the result of the huge public health operation in China. It is very hard, though, to predict. We definitely see that the behaviour of the virus outside Wuhan, Hubei, in the rest of China, and outside China doesn't appear at this point to be as aggressive or as accelerated, and that's a good sign. And that gives us an opportunity to prepare and to react, and still gives us the opportunity for containment and potential interruption of transmission of the virus.
But the death count, the daily death count is rising. How do you explain that?
The other interesting work that's being carried out is many countries have accelerated their normal winter surveillance for severe acute respiratory illness and ILI. And many countries like Singapore, and I think Singapore stands out as a really good example of a country that's approaching this virus in a very systematic way, are now checking in emergency rooms all respiratory infections, and they're testing for nCoV. So they're not just testing against the case definition, they're testing all respiratory disease. And to date, they're not finding COVID as that. They're finding the flus, they're finding the other things, but they're not finding COVID as part of that. Now, that doesn't mean that that won't change. But in principle, at the moment, there's no overwhelming evidence that this virus is out there causing efficient community transmission in other countries. Now, that's a good thing. It doesn't mean it's not happening, but it does again highlight what the Director General has said again and again. We have a window of opportunity to shut this virus down.
This month, but it will be until April, let's say, it will be finished by April.
We need to focus on the task, and the task is to contain the virus, to detect the cases, to treat the cases. If we keep doing those things, yes, we may see a drop in the number of cases, but I think it's way too early to try and predict the beginning, the middle, or the end of this epidemic right now.